So the interesting question I received today was by one Mr. Prometheo on X. So his question is, can I have diabetes being really thin? And his follow-up question is, how can I know if I have type 1 or type 2 diabetes? So very good questions both. So the answer to this question is yes, you can absolutely have diabetes even if you are visibly thin. In fact, this is what happens to most Indians. They are not obese as in obese sense of the term word, but they are having diabetes. And why is this the case? So let me explain a bit about this. So what really happens is when you are in a calorie excess state, when you have a lot of extra energy on your body, you store it as fat, right? You store it as fat like anybody else. But in some people, or based on your genetics and some other reasons, you don't have the capacity to store that much fat underneath your skin, which is the visible fat. And as a result, what happens is your fat or your extra energy is driven to the internal body or the internal of the body, which would be the organs, the liver, and most importantly, the pancreas. In fact, these two are the most important organs here. And once that happens, and that fat is actually called visceral fat, and the fat underneath your skin is called subcutaneous fat. So once you develop visceral fat, something called as insulin resistance kicks in. And this starts with the liver and it proceeds throughout the body. And once your pancreas get fatty, your insulin sensitivity nosedives. And that's when you get proper type 2 diabetes. So in some cases, at least this is based on genetics, you might not have what we call as a personal fat threshold. You might have a low personal fat threshold. So what I mean by this is that you might not have that much ability to store fat externally underneath your skin, right? So the advantage of that is that you don't become visibly fat, you don't become obese, or you don't become visually unaesthetic, right? You can look at most Indians, they are not visually unaesthetic till the time they wear a shirt, right? You can see a person who's skinny, he's wearing a shirt, he looks completely normal, there's absolutely nothing wrong. You would never guess that he has a diabetes or a BP or whatever. But the problem is that you don't realize things are going wrong, right? Unless you are very familiar with all this and you do your blood work on time, or you have a very good doctor, you don't realize things are going wrong, and you already have a lot of fat in your body. This is why Indians actually have a lot of fatty liver cases. In fact, 1 in 3 cases are fatty liver cases in India. So as I was saying, when you have a low personal fat threshold, your body tends to store them in the liver and the pancreas and the organs, and that's when you develop type 2 diabetes. So it is absolutely possible, and in fact that is called a skinny fat or a TOFI, which is thin outside, fat inside phenotype. So this is very common, it is absolutely possible. So there is another possibility which he asked in the second question. So in case you are insulin deficient, or what we call as type 1 diabetic, then also you can be thin. Another possibility, a third possibility is LADA. LADA is another type of diabetes. It's an autoimmune like type 1. I'm not getting into the details of stuff, but so these cases also where there is an insulin deficiency, also it is possible that you can have a skinny figure, a skinny structure. You will never put on weight as such, but you have diabetes. So the thing about type 1 diabetes is that you will get the diagnosis very early in your teens. This will happen in maybe 13, 14, even earlier than 8, 9, 10. So this is going to happen at that age, right? That's why it's called a juvenile diabetes, right? Like it happens in young children. It's a genetic condition, so it happens really young, and you get the diagnosis very quickly. So if you're feeling that you are somebody who's 30 or 25 or 40 and you're thinking I might have type 1 diabetes, you absolutely don't have type 1 diabetes. So be rest assured about that. The other type of diabetes I was hinting at, LADA. So LADA is also an autoimmune condition, but unlike type 1, you don't have a zero insulin state. Your body can produce insulin, but it just declines year by year by year, and eventually it becomes sort of like type 1. So in these people also, they usually have a skinny figure and have diabetes-like symptoms. So how do we distinguish between these three types? Let's say you are in your teens. Your son has this problem. He is very, very thin. He's diagnosed with a sugar, but we don't know how do we distinguish between them. The easy solution is that a test called fasting insulin. If somebody is not using external insulin, there is a test called fasting insulin. You can just take a fast, 8 to 12 hours of fasting. You can go get it tested in the morning. Some places you get the name as serum insulin as well. So get this test done. There's another test you can do parallelly called C-peptide. So get both of these tests done in a fasted state. Check the results. Right? I'm not asking you to diagnose it. If somebody is experienced enough, they can surely do that. But see if they are low. Right? If these are low and you have a high sugar levels, that means you either have a type 1 if you are a younger person, or you have something like LADA. C-peptide is the key here, and fasting insulin too. So if in case you feel this, like let's say fasting insulin is less than 1.8, 0.7, or maybe around 1, and your C-peptide is also somewhere around there, then, or the C-peptide is less than 1, then in that case, it is, so you see an endocrinologist, discuss with him and get a proper diagnosis. He might ask for a antibody test for confirmation, which unless he requests for it, there is no reason for you to spend that much money on not a simple test, but a test like that. Like, why do you want to spend 10,000-20,000 rupees on some test if there is absolutely no requirement? So if you get a suspicion, if you feel that the C-peptide value and the fasting insulin value was on the lower side, please get these values, please see an endocrinologist and get that sorted out. And if you are an older person, then type 1 diabetes is unlikely. It's either between LADA or type 2. And if you have a long history of diabetes, chances are it's type 2 diabetes. So that's about it. Proper test and proper diagnosis. And just because you're skinny doesn't mean you're free from diabetes, or you're immune to diabetes. You have every probability, I would say even more probability of getting a diabetes if you're unhealthy. So take care of your health. I hope this answers your question.